Moscow on a late afternoon in summer. City streets crowded with workers, businessmen, wives, and soldiers, anxious to be home, to meet with friends. The end of another working day in another city. But underlying the bustling activity is a quiet perseverance, a perseverance which might not understand, but which has learned to accept hardship. The knowledge that other nations enjoy higher standards of living is seldom remembered, and even to a stranger like myself seemed far distant. Russians have nothing to regularly remind them of the absence of luxury goods, of things they would like to have but can't, of what should be but isn't. During my summer travels in Russia, I found myself greeted with a warm curiosity, an easy hospitality. Chatting as best I could with people in the streets and visiting them in their homes, I found myself caught up in an aura of naturalness. There seemed to be a general lack of self-attentiveness, of a confining self-mindedness. The explanation of this attitude is not difficult. The Russians are simply too busy to think about themselves, and as a consequence, have lost the introspection which used to be considered a Russian characteristic. Mental illness in Russia is not a common topic of conversation. When asked about the comparative low incidence of mental disorders, they explain in a matter-of-fact manner that this can be attributed to their social equality. These two workers are standing in front of the walls of a psychiatric hospital. This hospital and others like it house 100,000 beds in Russia, not enough to meet the country's need. The Soloviev Mental Hospital in Moscow has 600 beds. Mental care comes free, and only the seriously ill get treatment. Here, the Odessa Psychiatric Hospital devotes itself to the care of 1,000 inpatients. Outpatient clinics such as the Odessa Psychoneurological Clinic give by far the most care. They offer early diagnosis, help keep workers on their feet, and out of the hospital whenever possible. This is the Pavlov Psychiatric Hospital in Kiev. I have just entered the grounds without escort and without notifying anyone beforehand. The atmosphere is one of relaxation and informality. Patients are not required to wear uniforms, and if well enough, can stroll languidly in the afternoon sun. This woman is visited by her husband. Though not enough hospitals, those which do exist, like the Pavlov Hospital, have enough personnel. According to Dr. Babian, Chief of Psychiatry for the Soviet Union, there are 4,000 psychiatrists in the hospitals. Each psychiatrist averages a patient load of 28. At the Pavlov Hospital, these psychiatrists average 20 patients each. The most surprising statistic is that over 3/4 of the doctors are women. A warm personal interest is shown by these lady physicians toward their patients. I would say a woman's touch. In addition to psychiatrists, there are 320 psychiatric nurses to care for 1,000 patients at this hospital. In the average Russian mental hospital, each nurse takes care of 6 patients. A fully qualified nurse must complete 3 years of special training after high school. Adequate numbers of personnel, tranquilizers, and sedatives make straitjackets unnecessary, and in fact illegal in the Soviet Union. The Russians have a long history of humane treatment for mental patients, a custom which started long before the Bolshevik Revolution. I think that every hospital administrator the world over has a pet project he wants to see completed. Here, the objective was to replace the bars on wards housing the violently disturbed with unbreakable glass windows. This gregarious individual is diagnosed manic depressive. Russians use the same diagnostic labels as we do, and as we do, they consider each patient an individual case. The familiar wringing of hands points up this woman's anxiety syndrome. But what has made the patients anxious? Conflict with the factory supervisor, fear of police, crowded living conditions at home? These and other reasons became apparent during my conversations with patients. However, I soon discovered that Pavlovian theory, which dominates Russian psychiatry, does not emphasize social causes as the source of mental disturbance. With this in mind, I journeyed to the Soloviev Mental Hospital and Clinic in Moscow to see how psychiatrists actually diagnose and treat patients. Here at the clinic, these children were waiting for news of their brother in the next room. He's receiving a neurological examination. If the problem is deeply psychological, the why behind the disorder is not brought to the surface, not measured by psychological tests, not analyzed by Freudian theory. A psychiatrist at Soloviev told me, "You Americans are more on theory than we." The doctor traditionally begins treatment with a complete write-up of the medical examination and case history. For an alcoholic, some psychotherapy and sedatives, but not the analyst's couch. For an epileptic, the same drugs as used in America. Hospital records show that epileptics make up 8 or 9% of the hospital population. A schizophrenic receives sleep therapy and insulin shock. Electric shock is officially regarded as a brutal form of therapy, and therefore is used infrequently. Patients diagnosed schizophrenic comprise 25% of the country's total hospital population. A victim of syphilis has arrived for treatment. Arsenic compounds will be used instead of penicillin, which is still hard to get in sufficient quantities. Patients with syphilis of the brain comprise about 2% of the Moscow hospital population. According to the Russians, in all of the Soviet hospitals, the rate of recovery averages 92.7% of arrivals and 61% of combined arrivals and residual patients. These percentages refer to those patients who are considered recovered enough to leave by the end of the year. As you can see, syphilis carries the same social stigma in Russia as in the U.S. These fifth-year students of psychiatry told me how they were trained to be psychiatrists. After high school, they received a medical education of 6 years and are taught almost exclusively Pavlovian theory. In Russia, the emphasis is on neuropsychiatry. The scientific study of inter- and intrapersonal relationships is definitely played down in importance. Basic Pavlovian theory as used by the Russians relates not primarily to behavior or environment or mind, but to the brain. Students rely therefore heavily on drugs and on a Russian specialty called sleep therapy. Dr. Shabanova, only 25 years old, has placed electrodes over the eyelids of the patient and set the control to 10 or 15 milliamperes. She will maintain the sleep for 1 hour. Electric sleep rather than shock is commonly used for depressive patients. Work therapy and supportive therapy go together. The Russians feel that useful activities develop wholesome social attitudes, attitudes which psychiatrists analyze by what they call common sense, not the psychological tests or Freudian analysis. Freud supposedly overemphasized the role of sex and instinct, officially branded in Soviet Russia as philosophical idealism. The psychiatrist listens sympathetically to the patient's problems and then prescribes medical treatment or advice for her to follow. The basic aim in treating her is to restore the patient to good health and to the community. Russians do not strive to get the patient to understand his whole mental life, to gain deep insight and understanding. They appear satisfied to get the patient back on his feet. There is no doubt that Dr. Kasaya is effective and sympathetic as a doctor with a heart. But one cannot help wondering whether or not training in depth psychiatry would make her still more effective. Psychiatrists can get most patients back on their feet through chemotherapy. But what about the actual roots of the disturbance? Dr. Kasalia keeps children active at play. Her children's ward has 25 patients, serious cases involving epilepsy, brain tumor, and brain damage at birth. For these emotionally disturbed children, life is kept as normal as possible. Here we see a class in biology being conducted in the hospital itself. The Soloviev Mental Hospital and Clinic marks the end of a 3-month tour in Russia. As a parting gesture, Dr. Nebyevich invited me to visit her little boy, Sasha, whom she calls for at his nursery at the end of each day. It struck me that the motherly affection she shows Sasha is the same basic interest and concern that she and others like her have shown their patients at the various hospitals I visited during the summer. Although there is a basic dissimilarity between Pavlovian theory and the concepts of Freud, which has had widespread influence in the West, Russian psychiatrists, even though they function in a different ideological sphere, have one thing in common with doctors all over the world. They want their patients to get well as quickly as possible. To restore them once again to the society they live in.